Hello and welcome. My name is Andrew Tatarski. My pronouns are he and him. I am the Director of Clinical Programming at the Freedom Institute, which means that I oversee clinical services and our harm reduction treatment training program here. I want to really welcome you. I'm real excited to welcome you to this very, very special event. It's our monthly Meet and Learn, applying integrative harm reduction psychotherapy to groups with Dr. Adam Frankel. Adam Frankel is a very, very special friend, colleague, and person, and I'll be sharing a bit more about him later. But first, I'd like to say a few words about Freedom Institute and our Meet and Learn series. Freedom Institute is an outpatient addiction treatment program in Midtown Manhattan, and we've been here for 50 years, although I'm a relative newcomer. We offer the highest quality, or certainly strive to offer the highest quality care to people who are struggling with problematic substance use and addiction. Our focus is comprehensive, individualized, harm reduction informed treatment to people wherever they're ready to begin their positive change journeys in all stages of change around all positive change goals. We might consider that the harm reduction frame is really based on radical acceptance, starting where people are and doing what works with compassion, with respect, with empathy, and collaboration. So it's really a kind of a paradigm shift from an earlier abstinence-only approach that we believe was really effective for some people, but very limited in its effectiveness for many people. And we think that these harm reduction values and qualities really best lend themselves to facilitating safety and alliance, which is really the foundation of all effective helping, and therapeutic relationships that really best support people in their positive change process. Just the way that we operationalize harm reduction informed addiction treatment is that we are keeping abstinence-focused services for which Freedom has been known for many, many years. We have an abstinence-based intensive outpatient program for people for whom that really best serves. But we've expanded and are on the verge of starting what we call a mixed goals intensive outpatient program. This will be a program for people who need and want structured intensive treatment, but are not committed to lifelong abstinence, or may be committed to abstinence, but are really unclear about their long-term goals. So this would be a program that would really be appropriate to meet the needs of people that are unclear about their goals, are ambivalent about change, may be interested in exploring the possibility of moderation. And I think this group of people really have not had a place to go before. And alongside of those two intensive structured programs, we offer a full range, a full menu of individualized services, including individual, group, family, and couples therapy, and certainly, psychiatric and medical care where that's needed. The focus of today's session will be on groups, which we believe are just a really, really important and valuable modality for folks that struggle with substances across the entire continuum of care. Now, our Meet and Learn series is really geared toward exploring the many ways that harm reduction treatment may be applied to working with different groups of people, different modalities, etc. And so we have a number of exciting events coming up over the coming months, including a focus on couples, on families, on the needs of the African American community, the needs of Latinx communities. We'll be looking at the value of adding a ketamine treatment into a comprehensive harm reduction informed addiction treatment. So we hope to create events that are really meaningful and speak to the needs of the community. And we really invite all of you to interact with us. Let us know what might be helpful. I developed integrative harm reduction psychotherapy really as a kind of corrective or response to what I saw as the limitations of traditional abstinence-based treatment. And I really believe that it can effectively support and enhance the work of comprehensive addiction treatment across the entire continuum of care, including in abstinence-focused services. This model is really based on a view of problematic substance use and addiction as meaningful responses to suffering of all kinds. And as a result, we really bring together relational, psychodynamic, cognitive behavioral, and mindfulness strategies in a harm reduction frame. So this session is focused on harm reduction in groups. Adam Frankel was a colleague of mine at the Center for Optimal Living for 10 years. We worked closely together, and he is really the foremost contributor to integrative harm reduction psychotherapy in groups. He has created workshops and lectures and has offered this work, sort of versions of what we're going to hear today in many places around the world. And so it's just a wonderful thing to have him agree to share his wisdom and experience with us. His bio: he's a psychologist who specializes in the treatment of substance misuse and co-occurring issues. And now we are joined by Adam Frankel. Welcome, Adam, and thank you so much for being here. He looks at substance misuse in the context of a whole range of life issues and emotional challenges, working from an integrative harm reduction psychotherapy approach. He is certified as a group therapist with the American Group Psychotherapy Association. In fact, when he came to work with us at the Center for Optimal Living, he had already been a seasoned group therapist. And now, 12 years later, he's really becoming, I think, a master in this area. He's a teaching faculty member at the Eastern Group Psychotherapy Training Society. He presents nationally and internationally on integrated therapeutic treatment modalities, and he's a clinical supervisor and teacher to mental health professionals throughout New York. He's worked on inpatient and outpatient hospital settings. He's run intensive group treatment programming. At the Center for Optimal Living, Adam would run 3 or 4 groups at the same time and was, always energetic and excited. And he really brought a very special expertise to our team at that time. And I know now he's in private practice here in New York and in the San Francisco Bay Area, where he continues to run groups. I might say just another word or two about Adam, because Adam is a man who is constantly evolving and exploring and integrating new modalities. He's done training in schema therapy, in transformational chair work, in more affective focused therapies, in IFS. So this is a man who has a lot to share with us. So thanks so much, Adam, for being here, and take the floor. We're going to have about a half hour, give or take, to dialogue with the community that's joined us today. So put your questions in the chat or write them down, and we'll really love to invite dialogue with everyone. Take over, Adam. Thank you. You're muted.
Andrew, thank you so much for that warm welcome. I really appreciate it. I'm going to ask the excellent Shanta Langford. Shanta, is there a way that I can see people visually, or no? This is, yeah, okay. So I'm going to put this way. So right now, okay, perfect. So everyone knows, so I can, I'm seeing myself, so I'm gonna talk to myself right now and try to talk to everyone as well in this context. Andrew, thank you so much for the warm welcome. I really appreciate it. Welcome to everyone who's here virtually for this talk, and hopefully communication. We can have a bit of back and forth. Just so folks know, as far as structurally, I'm going to go through slides for hopefully keep it to about 15 minutes, and then I have written up a mock group of an amalgam of harm reduction groups that I run that hopefully can give a taste, a real life taste of the of some of the principles that I'll be speaking about today. And I've had very generous individuals who are going to role play the characters. And so what you're going to see is you're going to see slides that come up, slides that go down, and then we're going to put up the script. And so you're welcome to just follow along. You'll see the different character names and you can follow along. You're welcome to put your questions in the chat. Structurally, with our time frame now, I'm going to you're welcome to put any questions you have, and Shanta, who's going to assist me, as well as Andrew, will hold some of those questions, and then we'll go through those at the end. Okay, great. So with that in mind, I think that Andrew gave that very warm welcome. Context really, I think, matters. And so just so this group here together, us building this group for the next while together, knows I really love groups. I believe in groups deeply. I love them. I think they're tremendous agents of change, particularly as it relates to substance use processes. In particular, I first was exposed to groups on inpatient, outpatient, intensive settings in New York City in IOP programs, and then more individual run groups. And my real hope is, if there's anything you can take away from today, it's both a continued, hopefully, excitement about groups, about the ways that we can think about harm reduction in both substance use tools, strategies, and also the position as harm reduction therapists in group settings as effectively as possible. And I'm mindful that some people here may be very seasoned in groups and also very seasoned in harm reduction. My hope is the ideas here then are a refresh, but also I think going through the structural kind of foundational things can always be useful. And then for those who are new to group processes and also harm reduction in general, welcome. And I really hope that this piques your curiosity and interest. If anything, Andrew and Freedom Institute, amongst others, they have year-long trainings and 3-day workshops and monthly supervisions. This will be an absolute taste, but my hope is this taste really piques an interest and curiosity as part of your process. So with that in mind, I'm going to ask Shanta to put up the slides and we will begin. Perfect. Okay, great. Great. So the presentation today, Integrative Harm Reduction Psychotherapy and Group Psychotherapy, some core principles. So what are my hopes, some takeaways for today? My hope is that there are some core principles of IHRP that you will either relearn or refresh or also find anew. The introduction of the IHRP 7 therapeutic tasks, which Andrew really facilitated and developed. I have thought about them for a long time, for many years, and really think they have wonderful applications to groups. And so I'll be seeing how they apply to groups today, and we're using that as part of the table read into our work today. Okay, so just kind of as we think about stepping in this way, I love this quote, and I think it really speaks to the group experience. Tell me and I forget, teach me and I may remember, involve me and I learn. I want to propose that in group work, as group therapists, one of the most useful, I think, frames and positionings that we can hold ourselves in this process is how we can involve our members. And I think harm reduction beautifully invites us. Can we involve ourselves relationally as co-collaborators in a group process? Can we help involve members both affectively and emotionally? Can we involve members relationally in the here and now? And I think that we'll be speaking more about this, how to involve group members in the process. And I think harm reduction more generally and IHRP in this collaborative mindset really beautifully facilitate involvement in a group process more generally. Some high-level ideas for those. What is harm reduction in psychotherapy? As Andrew kind of touched on, fundamentally a philosophy and set of therapeutic interventions that seek to reduce harmful consequences of substance use and other risky behaviors without requiring abstinence to engage in treatment. Reduce harmful consequences in substance use and other risky behaviors without requiring abstinence to engage in treatment. All I want to touch on here is, therefore, this beautifully opens us up to the possibility, or it opens us up to the reality that harm reduction is not in any way, I would propose, at odds with actually abstinence-based models, but actually is very much inviting under the umbrella of that. The reduction of risk, abstinence being a wonderful step into the reduction of risk, and abstinence is welcome very much so in the harm reduction umbrella. And I think that's so important when we think about individuals who come into harm reduction groups and just substance use groups more generally. Other philosophical ideas, a social justice movement on a belief in and respect for the rights of people who use drugs, and asserts that members of stigmatized populations deserve the same respect and care that the rest of society gets. As we continue to think about our positioning as harm reduction group therapists and group leaders, this movement into a respect and really honoring individuals who use drugs, moving away from stigmatization, moralization, criminalization into something that positions us to a mindset of curiosity, of willingness to engage in a very connected way. Other core principles: risky behavior will always be part of the human repertoire. People engage in risky behavior for a wide variety of reasons. People who misuse substance are not bad people morally or otherwise, and someone who's misused substances is an individual, not an addict or diseased. So also, if we think about these philosophical principles, how that helps us position ourselves as harm reduction group therapists, when we welcome an individual into the group and move them away from a binary of someone is addict or diseased or just biologically driven, the factors for use, and also moving away from this notion of kind of being bad or wrong, it really opens group members, I find again and again, up to the invitation for them to be curious about their experience and moving away from a shame-based experience and also a pliant experience, meaning the idea that one needs to submit to a group process or a group leader or kind of move away or rebel from it and into something where there's a real co-collaboration. Other final principles: individuals should be met where they are in terms of their motivation for change. All positive change is meaningful, even if small and incremental. Substance use is on a continuum of risk. The goal is to move on a continuum towards that reduction of risk. And substance abuse and other risky behavior are best understood in the context of the whole person in their sociocultural context. Again, this really just opening us up philosophically. I mean, I think one of the things that opened me up so much as a group therapist was an internalization of the core principles, because it then really opened me up in the group experience when someone was making a change from 6 drinks a week to 2 drinks a week, or wanting to consider abstinence, or having an abstinence then a slip up. The notion of we're on a continuum process, all change being meaningful, it both opened me up for energy and motivation to be with their experience in a new way. And then it also modeled for them the possibility they could hold the position of hope and also engagement in a new way. And this idea that we're always thinking about substance within a sociocultural context, we think about harm reduction within a psychobiosocial model as opposed to a traditional biologically based or genetically based disease-based model. What does this invite us as both as group leaders and as members? In the group process, we're thinking about the complexity of the factors that are driving use experiences, psychological factors, biological, social, cultural, habit, routine that are intersecting in these reinforced ways, as opposed to it just being a biologically based process. Not to say that isn't a deeply important part of the process, but rather there's a yes and, there's more. The umbrella invites more. And I think it really, for so many group members, it frees up the possibility that both for the respect for the complexity of their process, also destigmatizing it, deshaming it, and really inviting more energy to engage. A quick contrasting with more traditional abstinence-only approaches, again, I would propose that at all at odds, it's within the umbrella, but historically this contrast. Harm reduction as a psychobiosocial model, as we said, as opposed to a strictly biological disease-based model, moving away from this notion of a one-size-fits-all approach, as opposed to a fit for each person. That is to say, also in the group experience, we may have unique goals for each person instead of only having one goal. Now, I know many of you here run absence only, let's say, focus groups, or let's say mixed goal or a harm reduction focus group. What I want to propose is, if there is mixed goals or even not, we really want to think of, there may be unique goals even within certain categories of experience. And we want to respect that from a harm reduction philosophical perspective. And then connected to that, moving away from this notion of categorically one is an addict or not, or one is an abuser or not, into this spectrum of experience. Maybe on Tuesdays and Thursdays, an individual from our groups is engaging in high-risk use, and then maybe on Saturdays and Sundays, it's actually a much more moderate frame. There's a complexity to it, and driven often by context. So just for us to associate, I think this also, as we think about ourselves as group leaders and also in group experience, context really matters. And when we think about the factors that are leading one to engage in substance use, for many factors, some may be to manage unpleasantness, some may be to manage neutrality, others to actually find positive dynamics. And so in a group experience, to really get curious together about, wow, in certain contexts, the use dynamic is for spiritual processes, for actual fun, pleasure, liberation, for actually facilitating my identity, for other times negotiating trauma, shame, guilt, self-regulation. And there can be both a complexity to it, but also a really teasing apart how we want our ideal relationship to be. And that may involve absence, that may involve moderation, or a willingness to even try to step into one of those things. So I was thinking and sort of thinking about this presentation, what are some of the attitudes, kind of the high-level ideal attitudes, or the positions as a harm reduction psychotherapist in group leadership we want to be thinking about? Andrew mentioned them some in the beginning, this notion of collaboration, curiosity, compassion in the work. I want to propose that these, and just so everyone knows here that all these slides will be sent to you, so you can really kind of see these slides as kind of ways to think out loud for yourself together here. We're moving into this position of deep curiosity without a personal agenda. So many, I think, group processes can sometimes get in conflict when there's a sense of implicitly or explicitly the group leader has a certain agenda about how they want things to be. Even if we have a sense clinically that actually absence would be in someone's most adaptive to their wellness and risk dynamics, we want to really see, as Andrew mentioned, where they are motivationally and begin with that as a way of opening up their authentic energy, as opposed to moving into this dynamic where there's submission or compliance processes. Always thinking in a group process about what are the dynamic functions of use patterns. And I think this just so opens up rich conversations when it's not just because of an addict or disease, but it's also there's biological factors. Oh, on that Tuesday, there's actually this routine that unfolded. And also there was a psychological dynamic where I was feeling this thing towards this other person outside or in the group experience that also facilitates this. We're thinking about complexity. It adds often to a deep richness in the group experience, and I think a sense of humanity. The facilitation of communication between members, often many members in group processes, especially those who can use substances, there can be a movement avoiding or moving away from affective experiences as group leaders, just like in all groups, but I think especially harm reduction or any sort of substance use process groups, how we can bring emotional communication into the here and now. John was just speaking about substance. Sally was just speaking about substance. John, how are you feeling right now towards Sally as she's sharing it? What is it like for you to hear someone else is going through something absolutely the same? Talking from the there and then into the here and now and bringing that together. This notion of embracing and normalizing ambivalence in the process, really being able to respect when there's ups and downs in the process, completely understandable, as well as when a part of me wants to use, a part of me doesn't want to use, and how we can really reinforce those things. Skill development together. The three pillars that I think are beautifully organizing for my work as a harm reduction leader is this notion of exploration, looking at function and dynamic meaning, things that are driving experience, looking at the pillar of motivation, how we can help get a sense of what an individual or group member's motivation is towards making change, and then also what are the tools, strategies, systems, what is the behavioral dynamic that drives those changes? And I think groups are beautiful ways to look at meaning making, motivation, and also building skills. We can build skills together. I'll talk in a little bit about this notion of urge surfing, or the idea of skill building real time. Someone is experiencing an urge as someone else is talking about a use experience. Can we actually be with that experience, breathe with the urge, look at actually what might be there? Oh, there's a part of me that feels so jealous of this person. They can engage in use in a moderate way and I can't. Or actually I feel like I can't control the urge. We can practice these things real time together, which I think all these things really activate both willingness as well as a sense of hope and possibility for change, and just seeing other people make change, I think being so powerful. With that in mind, that sort of takes us, it facilitates, it moves us into these 7 therapeutic tasks. Now, as I mentioned, I'm just going to absolutely touch on all these. Andrew gives workshops and 3-day lectures and on about all the particulars and year-long stuff on this. I am going to invite us all into a taste of these principles and tasks, and then we're going to do the table read and move into from there. Importantly, These principles and ideas are an amalgam of a variation of psychotherapeutic traditions and techniques and theories. What I think Andrew has done well, and I think the harm reduction community has done well, is the orientation of organizing them in a useful frame and roadmap for clinicians, for us. And I think especially for group therapists, I thought a lot about this, about how we can use these tasks and principles as they connect to group work. 12 o'clock is task 1, managing therapeutic alliance, and it moves clockwise. Managing a therapeutic alliance. What is this? Definitionally, the ability to work purposely together in agreement about the goals and the tasks of the work. For many folks, this will be obvious, right? This is the heart of so much of psychotherapy. We're looking in our groups as harm reduction therapists. What is the quality of the group bond? We're really trying to track that. What are the tasks that we're working on collectively right now? And are we noticing any rupture processes? This question that we ask ourselves as group therapists and harm reductionists: can we develop a relationship with the group so they can trust us and one another? And then how do we not impose our views onto the process? Keep an eye out in the table read today for Pat and Sean in particular around the alliance both between one another and the group process. Task 2, the therapeutic relationship heals. At a very high level, helping to foster interpersonal relationships in addition to clients' relationship to substances. This theme that many may be familiar with, this notion of the opposite of addiction is connection. Groups are just, as many people are well aware, just profound vehicles to be able to move into interpersonal contact as opposed to and away from substance use processes. Like we said in our principles, we're trying as group therapists to facilitate here and now emotional immediacy. And I like to think of it as, if someone is talking about something from the outside, how can we bring it inside? In this moment with John is talking about their use pattern outside in the experience. They're talking about a craving and urge that they had Tuesday. John, I'm wondering, as you say that, was there any time in the group over the last 20 minutes you had a craving and urge? Was there anything? Did anyone have a craving or urge in the last 20 minutes? Can we bring in the emotional experience from the outside into the inside? Various techniques to do that, and we'll see that in some of the script, joining, bridging, functional subgrouping. And so just look for moments of emotional intimacy that deepen in group members. Look for Pat in particular and the whole group. This addition of task 2, the therapeutic relationship heals, adding into the self relationship heals as well. Movement from shame and self-attack into curiosity and exploration. This movement away from I should, I need to, I must, into I'm choosing, I'm going to, I decide, opening us up into this idea of ideally agency and a sense of movement into what we want and what our ideal frames are. But it really begins with curiosity. And so many individuals that I see who come into my groups, currently I run 4 groups, and I've run a couple of them for over 10 years now. And so many people have started groups that I've run because they've been in other groups that feel like there was so much shame that was actually driving use experience, or driving kind of absent-based experiences as opposed to kind of willingness. And we're really trying to move into this as much as we can. So really take a look for Sean in particular in the group read. When do you see shame or experimental mindset come out in the group process? Task 3, enhancing self-management skills. So many individuals who negotiate substance use challenges have challenges with emotion regulation, negotiating internal experiences of emotional experiences, cognitive experiences, physiologic experiences. There's a milieu of tools that we can use. Group dynamics are just incredible avenues to bring tools in real time. If there's a takeaway, the invitation is, if we could give an invitation for our members to practice something outside, is there a way we could practice it inside? Urge surfing, assertiveness training, self-friendliness practices are all 3 general practices I used, and we'll see that a bit in the table read, and we'll get into what urge surfing is in particular. Look for this in Alex. Task 4, assessment is treatment. We could say a lot about this task, but basically what I just want to highlight is, for many individuals, and I think many group members who come into groups after use experiences, they'll say, I engage in this, or I engage in use, or this was outside of my intention, or I use more than I wanted to. We want to really go slow with them to assess the lead up, all the particulars, all the nuance really matters, the thoughts, the feelings, the sensations. Can we explore it as a group process together about all those dynamics and potentially bridge other people into that? As Sally was talking about, what was happening before for her thoughts, feelings, experiences. John, what was happening for you? Did you notice similar things or different things? Can we all kind of do this? We call the microanalysis. Why is this useful? Often what it can speak to is the functions of the use itself, but also the parts of ourselves, the modes that gets expressed in these actual processes. So that is to say, guys, yeah, I just came in and, I want to start the group. I ended up using outside of my intentions. I wanted to be absent on Thursday, but I ended up drinking, had 5 drinks. As we just slow down and go kind of micro into what the specifics were, it's so interesting. I noticed this like very young part of myself come out. I wanted to connect with people and I just felt like so anxious. I don't know. It feels reminiscent of a much younger time. The particulars open us up to these other parts of ourselves, which in the group experience, then we can explore that together. Also bringing into values conflicts that could come up. We'll get into that in the script. And it really helps both with treatment planning, getting a sense of when we go through the particulars, see that frame, how might we want our ideal frame to be in the coming Thursday or in the coming days, as well as normalizing just the exploration of substance use experiences. I don't know if others experience this, but I definitely do. When I started leading groups, oftentimes it's like this, like I want to just get away from it, stop it. And like, we're just going to kind of keep moving. Yes, we want to keep moving in progressive, adaptive ways. And the exploration can move us into actually more empowerment and more freedom of choice. Kind of what I spoke to a bit, the microanalysis, really just all the particulars that lead up to experience. Just these questions for so many group members, they don't even think of. It's like, what are the body sensations? I don't know. I don't have body sensations. Let's slow down. Can we all as a group open this in this way? And then just other questions. You notice thoughts before the use. What are your feelings right before, after? How intense are the cravings? So forth. Just all the specifics inviting us to really get into, and we can bridge one another. John, do you have a sense of what is unfolding for Sally? Like, we might think John and Sally have a similar situation. Maybe we ask John to invite to think reflectively about what Sally's experience is as a way of bringing them in, a way we can really continue to involve one another. Unwrapping the urge, I'm this last notion, and then I'll stop in just a few and we'll get into the script. What I want to say about this is just to say urge surfing and unwrapping the urge. We could do kind of a whole workshop on that, but just the basic idea that there's often rich meaning, symbolic meaning, and not just biological meaning in urges and cravings. Most people, or many group members that I've worked with, think of their urges as just sort of not symbolic or not meaningful. There's often tremendous richness in that process where there's actually a lot of meaning, a lot of desire, a lot of yearnings that I have underneath that, and we can explore that in the group together. This task 5, and this is what we're going to be focusing on today in particular, what you're going to see in the read, exploring all parts of the self, the parts that want to keep using and the parts that don't want to, really just normalizing that ambivalence and often conflict about the part of you that wants to use and not is a normal part of the substance use experience, and just holding both sides with curiosity. Take a look for Pat in the group. The way we're going to do that today is in a decisional balance. As Andrew said, I do a lot of parts work. So a lot of my both mentor, friends, colleagues, people who have been very influential in my life work in a very parts work way. So internal family systems, Gestalt chair work, transformational chair work. And my hope is you'll see it kind of embodied. This decisional balance, the top left, looking at the benefits of the use, bottom left, costs of the use, benefits of making a new use plan, and then also the bottom right, the cost of it. Just looking at both sides, there can often be so much energy that builds just by being able to look at in both ways. That moving into embracing ambivalence, allowing us to, in some way, getting a sense of how do we want to set goals, and helping group members, this task set 6 of goal setting. We sort of think about it as like, if we think about like no mountain climber would go up a mountain without any sense of where they want to move. And it's like that invitation of how do we want to plan together? Groups are fantastic resources to be able to plan out loud together. What is the roadmap? How do we want our ideal relationship with substance to be? And it might be context specific. For those who run absence-based groups, that might be, I'm going to have my ideal use plan as trying to decrease emotional, affective experiences on Friday, Saturday, and Sunday. So instead of going up to be with certain people, places, and things, I'm going to go do other healing or helpful exercises. For those who may be involved in substance use, maybe Thursday is different than Sunday, and I may have specific plans. But really also, I think very existentially as well, how does this orient to our values? What are the core principles and what are those guiding intentions that can help us orient to our frame? Lastly, as we think about goal setting principles, this notion that change isn't linear, it goes up and down. So us as harm reduction group therapists really wanting to normalize that and reinforcing that the small is the win. You know, John and Sally, they went from 6 drinks to 2 drinks. That's wonderful. What was actually working? How can we continue to support that? And this normalization that moving away from our intentions at times is totally part of the change process. And then lastly, taking our values, taking our ideal use plan, how do we want our ideal relationship with substance to be? Knowing that our ideal relationship may absolutely involve abstinence, how are we going to actually put that into practice? The systems, strategies, tools, groups are phenomenal beta testing, experimental places to do that. I sometimes tell some of my groups, this is an emotional gym. We're working these things out. It's all a beta testing. And then can we watch this together as it unfolds? Again, these 3 principles of looking at meaning, looking at motivation, looking at behavior change, all 3 things I think can be done very well in a group process. So with that in mind, Shanta, thank you so much. We can stop this slide. And I think because of time, what we're going to do is we're just going to go, Shanta, writing the script. So I have Shanta here, Izetta, and Andrew will be here as well, it seems like. Perfect. Great. So guys, thank you so much for doing this. So for everyone watching here in the ether, as we're together in this group in this way, just keep an eye out on any things that you may see that particularly relate to task 5, this notion of embracing ambivalence, what it looks like. All questions and all ideas are welcome. We're going to go through this for maybe 15 minutes or so, and then we're going to open up to questions, thoughts, reactions. As I said, this is based on an actual script that I've created off of groups that I run. For time, we're going to imagine this is in the middle of the group. And this is an ongoing group. I'm going to play the moderator, the moderator and the leader. And then, so Shanta, I'm just going to say out loud, Shanta, I'm going to ask you if you can play Pat. And if you can also play Rachel. Shanta, you're going to play Pat and Rachel. Jocelyn, if you could play Sean, that'd be great. Thanks, Jocelyn. And Andrew, if you could play Alex. Andrew, if you could play Alex. And Izetta, if you can play Betty. And I am going to play also Brian. I'm going to play Brian. Yep. Great. Okay, perfect. And you know what? I'll also play Kyle. Perfect. Okay. And if we have any questions, just let me know. Okay, great. So we begin. So this is an open-ended harm reduction psychotherapy process group that runs every Wednesday from 6 to 7:30. Currently, the group is closed in membership. The contract made with the group members when they joined is that the group is focused on exploring one's relationship with substance use, practicing harm reduction skills in the group, and interacting with others in a group setting to collectively help individuals make positive change related to their substance use experience. The group is told that all areas of their lives are welcome to be discussed, not just explicitly substance use. And the group has been going on for about 45 minutes, and we begin with Pat.
Hey, Brian. I'm really impressed with the work you've been doing tonight. If it's okay, I also want to bring something up.
Yeah, thanks, Pat. I appreciate it. Yeah, I'd also like to hear from you. What's going on?
I don't know. I don't know how I want.
Mm-hmm.
I don't know how I want my ideal framework to be with alcohol right now. As you guys know, the last 2 weeks I've been drinking about 2 glasses of wine at night, and that's been actually okay. But in the past, this frame generally after about 3 weeks turns into stimulant use for me, and I'm completely not okay with that. As you guys know, I started drinking at my family's wedding because I was so anxious and it helped a lot. Drinking does help a lot with social anxiety and relaxes me in the moment. Do I want to keep this pattern though? It hasn't led to a good place in the past. I feel like I can't control it now in ways I never had before because of new strategies. But it is worth the possibility of me going off the rails. I want to bring it up because I'm unsure. I'd like to get people's thoughts. I'm worried about you. I definitely know what it's like to start a pattern that hasn't worked in the past, and then it goes totally off the rails. I've been there so many times. I guess I'm wondering, why risk it? Are the benefits really worth the cost? I know. I think you're right. Why risk even trying, right?
I'm Matt, right? Sorry, I think I spaced.
Jocelyn, why don't you do Matt as well? Yeah, you'll do Matt. Yeah,
Okay.
perfect.
I hear, but at the same time, Pat, I feel like you've been able to manage your drinking the last few weeks pretty well, in addition to the wedding. And if you haven't used any cocaine or stimulants, so perhaps something is changing, no? Maybe you can make a healthy game plan around just the alcohol? For me, I found that my new alcohol use plan was scary to begin with. But when I saw I could keep a healthy frame around it, it was really empowering.
I agree with both of you. I'm not really sure what I want to do, though. I feel like I could go either way.
I'm curious, what are others' reactions? What are we noticing in the group right now to what Pat is bringing in?
I'm also in a similar situation. I'm working hard to make changes in my relationship with substance and I am, but I'm also on the fence a bit as well about it. Like, is the risk of drinking even worth it?
Yeah, Pat, I'm concerned. Similar to Rachel, for me, something I keep going back to from past groups is my values. Like, it can sometimes help me determine if ultimately it's worth it. I know we've spoken about this some in group before, but Pat, what's most important to you?
My family is definitely more important than alcohol to me, no question. Perhaps I'm in a different place with my alcohol, though. Maybe.
Hmm. I'm wondering if the group would be open to this exercise we've done before here, embracing ambivalence. In this exercise, Pat, along with all of us as a group, will help give voice to what we see as core benefits of Pat's current alcohol use pattern, as well as core drawbacks of the use. So, for example, Pat may verbalize a possible core benefit: alcohol helps me with relaxation in the moment. Other group members, maybe Matt, may sense that alcohol helps Pat with social anxiety. So Matt would speak from Pat's perspective, as if he was speaking from her voice, saying, alcohol helps me with social anxiety. And Pat, if anything that group members say out loud resonates with you in a strong way, I'd like you to repeat them again, and we'll practice this so you'll really get a sense. Yeah. And as we know, the statements we make out loud will relate to Pat because we'll be trying to take her perspective. And as we've done here once before, it may also relate to our own benefits and our own drawbacks to our relationship to substance. So in this exercise, we can learn more about our own benefits and drawbacks as well. And let's try, if we can, to keep our statements direct and simple. Would the group be open to trying to seeing where this goes, to try this?
Mm-hmm. Sure.
Okay, great. And Jocelyn, you'll play Sean as well.
Oh, okay. I think I might pass on this. I'll observe. I just might not say anything.
Yes, thanks for saying that, Sean. And like Sean, anyone else is just welcome to observe. So the group has done this before and has some said the exercise. So Pat, why don't you start with this now? Why don't you start with one core benefit of your current use pattern?
Alcohol helps me a ton with social anxiety. I'm able to interact with people in a more natural way.
Mm-hmm. Yeah. And Pat, if that feels true, I'd like you to say that again to us.
Alcohol helps me a ton with social anxiety. Alcohol helps me so much with social anxiety, too.
Alcohol helps me. Oh, sorry.
Oh, please. Yeah, go for it. Awesome. Yeah.
Alcohol helps me quiet my inner critic.
Yeah, definitely.
Pat, if that resonates for you with what Kyle just said, I'd like you to repeat that out loud again.
Yeah. Alcohol helps me quiet my inner critic.
Alcohol warms my body and helps soothe me.
I feel safe when I drink alcohol.
I feel safe when I drink. I feel like someone cares about me.
Yeah,
When I drink, my word. Oh, sorry. I keep
please,
forgetting
Jocelyn.
who I am.
No problem. Jocelyn, you'll be Sean and Rachel.
I'm so sorry. Okay.
No problem at all. This is all. Yeah, this is just so everyone knows. This is the beauty of harm reduction, right? We're always experimenting. This is great. Thanks, Jocelyn. So when I drink, my work and life responsibilities feel easier to manage. And when I drink, I start doing what I want. Like I want me time, and I get that when I drink.
Yeah, when I drink, I get me time, and I want that. I want to do what I want. I want me time. I want comfort time, and I want to drink. I can drink when I want. That's so weird. That's totally my mom's energy right there saying that. She had 6 of us. She never said it, but she got alone time from us with alcohol. She just couldn't stop after she started.
I want comfort, and alcohol gives me comfort and me time.
Alcohol, especially at night, gives me comfort, and I want to be comforted by someone. I really want comfort, and alcohol makes me comforted. And my wife isn't enough. I want a deeper comfort than her, and alcohol gives me that, even for a little bit.
Pat, as you're saying this right now to us as a group, how do you feel right now?
This is actually surprising me. I feel sad. I really do love alcohol for that comfort. It's crazy. It really is like a person who gives me this weird care. I love that about it. It's so soothing for me. But clearly, it's not all good. A lot of bad comes from it as well.
Nice. Okay. So how now that we're sort of moving also in that area, why don't we take the other side, as a group as well? So we're gonna do the same thing, but give voice to some potential core drawbacks of Pat's alcohol use. And so, although we're here on Zoom, we can just imagine, take a sec, take a breath or two, let go of the energy of the benefits, shake it out just for a sec, shifting that energy and kind of coming back, to your seat. And we're just going to kind of settle into the other side, respecting the other side, the drawbacks of the experience. So the group just collectively takes a sec, takes a breath or two, sits back down into the experience.
When I drink, my sleep is much worse overall than when I don't drink. I get to bed faster, but the quality is worse.
When I drink more than 3 drinks, I feel anxious the next day.
When I drink more than I want, I feel angry with myself, and I go into a shame spiral.
Yeah, when I drink, I'm less present for my sons, and I really want to be present for them.
Yeah, when I drink, I'm less present for my son, and I really want to be present for him. I love my son.
Yeah, Pat, I resonate with you. Like, I love my son too, and being present for him, it really is so important to me.
Being present for my son is such a huge thing for me. And when I drink, I'm no longer present for him in the ways I want to be. I want to be a present mother.
This seems to be a deeply felt moment for Pat with important personal historical resonance, as her own mother was rarely present due to her regular abuse of alcohol.
I love my spouse, and when I drink, I don't talk to him because I'm so angry at him.
When I'm drink, I'm not honest with Sarah about my use, and I want to be honest with her.
The reality is I want to be honest with my wife.
I want to be honest with my wife. I love my wife and my son so much. I'm not honest, and I'm not present with them when I drink. When I drink, I'm not present with them. I go into myself and shut them out into my own little world.
I want to be healthy, and alcohol in the way I drink right now is hurting my health.
Yeah, I want to be healthy, and alcohol really, all substances hurt my physical health and make me eat like shit. It's hurting my physical health.
I get so ashamed when I choose to drink and drink outside of my intentions.
When I drink without telling my wife and keep it to myself, I really feel ashamed. Honestly, it's really important to me. I really want to be honest. I also want things to be different from how they were with my mother. I don't want to be her.
Why don't we check in as a group right now just to see what we're noticing? Pat, what are you noticing right now? Thoughts, feelings, body sensations. What is it like to do this right now?
I feel really sad. I also notice I didn't really know much about my mom's energy is still in me, and I really don't want to be like her.
Pat, I have a lot of respect for what you just did. It's like we're talking together, but also talking alone and hearing each other. It's more intense than I thought it would be. I feel sad as well.
Rachel, as you say that to Pat, that you respect what she just did, what do you feel towards her in that communication?
A lot of warmth and care.
That's great. Yeah, it's great you're letting her know. I'm noticing how much I can relate to you, Pat, in terms of both the benefits and the drawbacks for me, and how much I don't often acknowledge how it impacts me being present with my son, but it really does. That's the truth. I mean, Pat, I feel like that was kind of brave, like what you just did. I care about you.
I appreciate that, Matt. Thanks
Pat, what are you thanking Matt for?
for caring about me. I know my wife Sarah cares about me, but she rarely says it, and it's nice to hear. I can ask for more of it.
I really like that idea. I also noticed myself having an urge to drink alcohol when we were talking about the benefits of drinking. I really got triggered. And then when we shifted to the drawbacks, my urge went away. I mean, that's sort of mind-blowing. It helped me to see again that the urge is fluid. It doesn't just remain static or just keep going on forever. And I also noticed the strongest urge I had was an intense body sensation in my chest. That's really interesting. I hadn't noticed that before.
Really appreciating the work that we're just doing right now together as a group. And I'm curious, Pat, to come back to you, coming into the exercise, where were you? Kind of snap intuition in terms of making a change with your current pattern with alcohol. It was scale of 0 to 100, 100 being definitely want to make a change, 0, not at all. 50-50, 60-40. Where do you think you landed?
Probably like 55-45 towards making a change in some way, but pretty undecided.
Gotcha. Okay. And now after this exercise, where do you feel like you land now? Just totally snap intuition as you check in with yourself.
Probably something like 80-20 to making a change from how things are. This was helpful to clarify things for me, especially my relationship with Sarah and Max for me.
Yeah, great. Yeah, really nice. And just really respecting the work that we all just did. And, I'm wondering what others noticed or what you're noticing right now in this exercise, particularly in terms of your own possible urges and cravings that came up during the exercise itself.
So I have an issue with all this. I'm not sure what to do now. Like, okay, Pat's motivation is different, but now what? My motivation changes for a little while, but then during the rest of the week, it just goes back. And I have a sense of where Pat would go with this, but I hear you, Sean.
Yeah, Sean, that's great. I'm so glad you're bringing this in. And what's your feeling with the issue that you have as you bring this in right now?
Like some frustration.
Yeah, and frustration perhaps with me?
No, not with you. Like the whole change thing. Like it's not easy. It's not easy to just be like, oh, my core values are so important, and then things change. Like things don't change that way for me. And frankly, what if I haven't identified my values? And what if alcohol right now is better than anything else in my life? Like what then?
Yeah. No, Sean, it's so important. Sean, I think that's a key question. And I think that you're probably speaking for other group members as well, definitely for many people in communities and societies. And I have immediate reactions to what you're saying. I'm also wondering what other group members, what their reactions might be to your question, Sean. Group members, thoughts, reactions to what Sean is saying right
now. Sean, I know you started this recently, but I think we all struggle with, or at least I do, like being able to identify my values and things I want relative to the benefit of the alcohol. I mean, if alcohol didn't provide me benefit, I wouldn't drink.
Mm-hmm. Yeah. For me, it provides a lot of benefit and drawbacks. And what I often don't think about what I didn't think about before starting the group was how the drawbacks get in the way of my values or what's important to me. But just knowing what values I have and which ones I cross over when I drink from my plan, it's not enough for me. I need to actively strategize and generally create a plan. What we talk about here, and then actually practice skills, which I think is a big part of it, big part of our group process. But also just getting support, not being alone in it for me is key, kind of like we're talking about now. And just not being ashamed of my drinking as well. It's just getting interested in why I do what I do instead of just attacking myself for it. For so many groups in the past, I used to attack myself. Yeah. And I think for me, what helps and what Pat did and from my work in the group was more generally is getting a sense of my desire for alcohol was serving some function in my life that I wasn't even aware of. Once I started to see from our discussion that a huge part of my excessive alcohol use was really helping me to speak up when I felt angry with my wife, with Michelle. And it really helped me think about other ways to express my frustration without using just alcohol. And the knowledge wasn't enough. I had to practice being assertive as well.
Yeah, for me, what's coming up is that just learning that my urges and cravings aren't just physical, and they can also be meaningful in terms of underlying needs, the underlying needs I have that I'm not getting met, that I'm not getting met. As you guys know, it was so helpful to see that in a lot of my alcohol use, I really wanted to explore my own sexual energy.
Betty, as you know, I can relate to that as well. And for me, in Pat's case and definitely my own, um, I think intention setting and planning is key if Pat wants things to be different. We talk a lot about planning and intention setting to put things into action and what tools we put into practice. Like Dr. Smith says, no mountain climber would just walk up a mountain without any sense of a map or tools or strategies, and we'd be asking for trouble. But the first step is to get a sense of how we want through to be and why. That's what I see Pat doing with us.
Yeah, I think that makes sense to me as well.
I hear that. But what if you're not ready? What if you're not ready for any plan? I'm not sure I am.
Yep. Yeah, no, I think it's a great question. Yeah, Sean, I think that potentially the first step is to continue to explore your ambivalence and give voice to both sides of it. And if you're open to practicing basic harm reduction strategies, I think that's a good place to start. It doesn't have to be an elaborate plan necessarily. Having plenty of food, water, a friend if needed are three key strategies to help decrease risk and increase safety if you make the choice to use.
Yeah, I hear you.
Sean, how is this for you? What's going on right now?
I'm just in a different place, I think, than the others. I really don't want to stop drinking, but I'm also not ready to plan either. It all just feels like too much for me. Planning so specifically and all that. Alcohol is the best thing I have in my life right now. And sadly, I really can't imagine stopping it.
Mm-hmm. Yeah, Sean, look, man, you really don't have to stop. Really, I know this is from different other groups in the past. It's this is really your choice. You can keep drinking and also using crystal if you want to.
Oh, something must have brought you to the group, though.
Yeah. I know it's having negative effects on me and my work, and during the weekends I black out, and it's scary. I'm really here though because I'm afraid of losing my job, and I'm worried that if I lose it, I couldn't get support. But I'm not ready to make any changes.
Yeah, Sean, this process is really about you becoming clear about what you want and why, knowing your risks, and then also increasing the freedom, over time to make choices and acknowledging your choices. The reality is you are allowed to use drugs. And at the same time, it sounds like, as I hear it, something that's important to you is also to keep your job.
Yeah, it's important to me. I like my work in general, and the cash is great. Also, I've only been to one treatment 10 years ago, and they told me I'd die if I didn't stop. And I think I'm feeling like in any treatment I'm in, I'd be forced to stop eventually. But I know that's why they recommended I check out this place.
Yeah, Sean, I was that way as well, man. No one here is going to make you do anything or force you into anything. we're trying to help, give you a sense of support, and ideally you can make choices.
Dawn, what about a journal to track your drinking? That's helped a lot for me. It helps me stay interested and curious about my drinking and seeing patterns. Don't change anything, just track it.
How helpful is that, though?
It was really helpful for me to notice my pattern. I think to identify some of the benefits and costs from the use that could be helpful as well. It was for me today as well. It was for me today.
I've been tracking also for a while now, and I can definitely see a relationship between things, and the amount I drink often surprised me, which is helpful to me to see it. It'll definitely help slow me down.
I could try it.
Solid.
Yeah, I'd be open to trying that like a night this week.
Sean, that's great, man. That's really great. That's all it is, man. It's like small actionable stuff. That's awesome.
Sean, also for me, when I do use, having plenty of water, food, someone to call can help me with decreasing the risk of overusing. Yeah, I'd be open to that.
Do you have someone that you could check in with if you feel unsafe?
Yeah, I can.
Mm-hmm. Sean, this is it, man. Like what you're doing is harm reduction right here. This is it. So the group knows so that we're guys, as facilitating this tonight, we're actually running out of time, and so we're going to need to stop soon. And as we do each week in our checkouts, everyone's welcome to share anything they like the group to hold with you this week in your process. It could be intentions, reflections, thoughts. So the group goes on to share intentions, thoughts. This is actually what I do in my group. Everyone will take a few minutes. They can share intentions, thoughts, associations, reflections. And then we're just going to check out with this, and then we're going to open it up to questions, thoughts, reactions. Mm-hmm. And this is generally how I end most of my groups, or almost all my groups in this way, as a way of kind of bridging the experience. Group, so as we do each week, we're going to transition. And we're going to intentionally practice the experience of transitioning and letting go of the roles as members in this group tonight and moving into the night and into the week. And with those unique roles, goals, and the context that we're going to be in. And that kind of underlining as we talk about in groups over the week, like the power of context, the power of boundaries, and also transitions in the experience and process. And so what I'd like for you to do, if you can just, right, as we do, find a comfortable enough position for yourself, right? Like really allowing yourself to draw your experience inward and really practice the intention of pulling your energy inward, letting go of the role of being members in this context tonight. And really inviting us, as you just really breathe in and let go of the words, into this regular reminder that making meaningful change in any aspect of our lives that's important to us, particularly like with substance, it's a process that unfolds over time. And as you just breathe in and letting the air go, we're becoming curious in the breath about our choices and actions this week, in the real choices we have to make as we move further into reflection and curiosity. And just breathing in through the nose and really letting it go, moving away from membership in this context, really underlying again, we have choices to make, and practicing learning from one another about the functions of our use, the risks, the benefits, and ideally coming back, as you're doing right now, back into yourself, moving from that automaticity into this openness of reflection, ideally stepping in with intention. And really, if you can now, take a breath from the center part of yourself, the area right behind the belly button, and try to make a connection with yourself as you step out tonight. And this final last breath or two, just the continued recognition. It's just really hard being a human being. It's messy, it's complicated, and really in the process of change, it's just really nice not to go at it alone. And now a final breath and just letting it all go. Guys, wishing everyone well this week in your unique ideal use processes and frames, and really wishing everyone well, and we'll continue the process next week. Thank you guys so much. All right.
Thank you. So folks, we didn't plan this, but we have this amazing group of people with us, and I'd like to ask everyone here to stay. Shanta, who just left, Shanta Langford is our training coordinator at the Freedom Institute, and she's put this all together. So first of all, let's just thank her. I have tremendous gratitude for her work. But we also have these two other amazing people that have agreed to join us. I'm putting them on the spot now because they hadn't expected to be here, but Dr. Jocelyn Fromm is a psychologist who's working with us at Freedom Institute. She has actually primed to start a harm reduction group herself. She sees individuals and couples, and she actually worked for 7 years at our friends at Center for Motivation and Change. So we're real lucky to have her with us. And Dr. Izetta Briggs-Bowling is a doctor of social work, I believe a CASAC, a family therapist, a gambling expert. She is just a master of many things. And we're so lucky to have her with us here. She also worked with us for several years at the Center for Optimal Living. So I'd like to ask you to stay, and now we can take some questions. We have about 25 minutes, a little bit less than that. So we'll be succinct in our answers, but I thought it would be nice to have the whole group here. So,
yeah.
And Adam, that was just a wonderful illustration, bringing the group experience to life. I really felt like I was in the group and with connected to all of these other folks in that wonderful exploration.
Andrew, thank you so much. And with that, and as we take questions, guys, just a couple of things I just want to note in our group experience. And Jocelyn, thank you so much. And Izetta, Andrew, and Shanta, a couple of things. And this is kind of questions that come up for me often in these contexts when we'll do these scripts. First of all, just to state the obvious, this is a teaching script. And so sometimes I've got questions that are like, well, is this do our group members generally this sophisticated? Are they able to explore in this way? What I want to propose for kind of takeaways for today from the script, I wanted to try to articulate what are some of those theories from these tasks, how they get manifest potentially in group dynamics. And so for some individuals, for some groups, it may take a period of time to kind of get to these places we're really exploring, but what it actually looks like in this way. So that's a question that comes up often for me, which is, well, these all seem like very sophisticated, very open, very engaged people. Those aren't the people in my groups. Totally the case. That being said, what I just want to communicate is the spirit of the energy as a way then how we can position ourselves in this process when it comes to making change from harm reduction and also definitely in all the groups that we run. So anyways, I just want to say that. Thanks.
So we have the first comments. Alexis Palmieri, I believe she's probably speaking for the large group when she says, wonderful presentation. And do you provide this training to agencies? That's a wonderful vote of affirmation for what you've done and shared with us, Adam.
Thank you so much. Yeah, Alexis, thank you so much. I know I don't know you, but it's nice to know you now. I do. I've done this in various agency settings, and Andrew and I have collaborated in various agency settings, and happy to speak in any way about that and to speak more. But actually, just to speak, maybe just to yes and that, which is, I know Andrew knows this, Izetta, Jocelyn maybe as well, myself, which is, I think the beautiful thing about harm reduction group work, this can be this. What I was communicating was a process group in a general sense. To me, you can beautifully apply this. Like we could write a different script for an agency dynamic around group settings and agencies or group leaderships when we're working out in the field. I'm in California right now on the West Coast. Harm reduction out in the streets in California. This is done all the time in Oakland, San Francisco, Berkeley. You can do this work and apply these principles, I think, in agency settings in ways that can be very effective. So, yeah, I think it really can be done well. And an obvious point, all these principles for anyone here who's not running inpatient or outpatient psychotherapy groups, for all those people here today who are, working either on the streets or working in centers that are not formal group therapy, I want to propose what I love about harm reduction is that the principles apply, even if, in all these sort of group dynamics. So I'll just say that.
Yeah, and I want to take this opportunity to share with the group that we are planning our next in-person 3-day training. We call it Integrative Harm Reduction Psychotherapy Essentials, September, I believe 20th, not sure of the exact dates, but 20th to 23rd maybe, or thereabouts. And Adam is going to be co-training with me, and we're going to put a special emphasis on groups toward the end of the training. So if you have an interest, come to Freedom Institute's website and look under events, and you'll get the information there. So that should be a very special event.
Yeah. And Alexis, thank you. We could totally speak offline. That's very kind of, we could Florida and all that. That's great.
So are there other questions from the group for Adam or for any of the others who are here? Jocelyn or Izetta, I wonder if you have any comments about the experience or questions for Adam.
To say, going through the exercise, it was I really appreciated it, because I facilitate a mixed group of people with abstinence-based, as well as in harm reduction. And many of the questions and many of the comments are very similar, because people are processing their thoughts and their behaviors with alcohol. And even people that are that have decided to be abstinent, I have people that have been abstaining for many, many years, and they still express some ambivalence, and they're still able to remember what was beneficial to them when they were drinking, and then they are able to look at and explore with other individuals what made the ultimate decision for them. But we've created an atmosphere where everyone is able to appreciate and respect where each other are at that moment in their process of moving forward in reference to their, whether it's alcohol or substances from many different areas. So I just wanted to say that that you said the question that people say, or is your group this sophisticated? I think when you create an atmosphere of openness and honesty, people just say what they think and what they feel, and it will seem very sophisticated, whether the people are in a sophisticated place or not. It's just a place of openness and honesty.
Mm-hmm. Yeah, it's a great point.
So thank you, Izetta. We have a question here about, can you apply this to a support group setting that's a bit less organized, maybe in a drop-in setting, for example? I can imagine. Is that something that you've worked with, Adam, or worked with agencies that are doing that work?
Yeah, Tyrone, it's a great question. Yes, I think it very much can be, and it's true that in this script I was trying to highlight a number of the tasks, but I would say, Tyrone, I would say it really begins in a support group. Let's say it's a one-time support group and people know nothing about harm reduction, or this is all very new to them. I think just inviting them to have a conversation about maybe a high-level definition about what harm reduction is, and also inviting them just to get interested in, like, do they have any ideas about what might drive them to use? Like, just even like really basic opening questions can often be an organizing frame for a community that actually feels like it doesn't have kind of a grounding. Or, Tyrone, it might be, and that would be, for example, Tyrone, like task 1 and 2, right? I want to invite that. We just want to have a sense of, like, what are we doing? I cut a lot of slides out. I do this generally presentation in longer formats, but one of the group work is obviously like, what type of group are we running? Jocelyn may run a group different than mine, and Izetta's maybe different from Andrew's. And in let's say a one-time support group, it may just be about practicing intention setting. Guys, we're going to talk 45 minutes just about values and just about how does substance relate to our values. Or it might be, we're just going to practice this one skill together. Or it might be something like that. So Tyrone, I invite, just as Alexa's saying, it's the building of the rapport. And even if you have a one-time shot, maybe identifying what's one thing from the task, any of those tasks that you want to try to employ. And I think that can be a way to organize the experience in that way. So it could be educational, it could be supportive, skills building, it could be motivational. Yeah.
So Dr. Wendy Miller says, Adam, can you share something that happened in a group you were running that stumped you or was extremely challenging? And she says she thinks it's a beautiful presentation.
Yeah. Wendy. So for full context, Wendy is a dear friend and colleague, and a dear friend and colleague and a phenomenal group therapist and also presenter. So and I could see, and also just, I may be speaking to Wendy's, perspective, or others I've gotten feedback on this, which is like, yeah, Adam, this, the presentation, everything's flowing so well. It seems so nice. Like there's no conflict. Like no group runs like this, where it's like, I would say, Wendy, to your question, something that has, for me, been a challenge, especially in the substance use community, especially working in harm reduction, is at times people come into the group intoxicated. Or let's say they'll come in and this is I just want to bookmark this, right? It's a larger conversation, but some things that have been extremely challenging for me, someone comes in, they look intoxicated, or they look like they're on cannabis, or they've been using cocaine clearly, in some way right before. How do we negotiate this as a group? How do we deal with that as a group process? It's a longer bookmark conversation, but Wendy, that's something that often I can find very challenging and difficult. Also, I specifically didn't get into it today because this is just I just wanted to invite curiosity around groups and also IHRP. Aggression in groups and IHRP. It's a whole nother topic that I think deserves respect and discussion. As you saw in the presentation today, Wendy, that even when there was a little frustration, I drew it back to myself directly. Like, hey, Sean, are you feeling aggression towards me right now? And this is another bookmark thing for us. Like if Izette is in the group, Jocelyn, Andrew, myself, and Jocelyn has been using, Andrew's in abstinence, and Andrew's kind of pissed at Jocelyn. They're like, she's using and he feels like she shouldn't be using. How do we negotiate that? So Wendy, that's another thing that I think can be a very complicated thing. And it can get aggressive. And like, how do we work that as a group? I just want to bookmark that. So Wendy, that's challenging for me. But lastly, I had a group where people got yelling at each other. And like, how do you deal with it when some people are very, very upset? And that's always, when when the heat gets really high, that's always hard. So maybe Wendy, you and I can talk offline.
And also at our training in September, we'll have a bunch of time to explore all of these challenges in more depth. So maybe that kind of whets people's appetites a little bit. But Jocelyn, I wonder if I could invite you again, if you have a comment or a question that you'd like to share.
Yeah, I thought it was a super interesting script. I actually would love the opportunity. I think it's such an interesting exercise you led the group members through, and it really kind of formalizes questions that are in the harm reduction ether around like what drives you to the pros, the cons, but it kind of formalizes it. And then, as you said, invites, it puts one person on the spot, but also invites others to kind of directly kind of join in their experience. And I just thought that was like such a masterfully created exercise. And I definitely felt Sean's like aggression, frustration. And I thought like you, like obviously creating like a really amazing holding environment for people who are treatment traumatized, treatment frustrated, frustrated with themselves, and it comes out at frustration at treatment. I mean, selfishly, I'd love to ask you a question that I think might benefit my future group, which is, we've been kind of puzzling over who is a great candidate for a harm reduction group. And something we were wondering is the like contemplators versus pre-contemplators in group.
Yeah.
Like, do you have a thought on having pre-contemplator? Like, what are your thoughts on someone who sort of really is not yet, maybe they want to be in treatment because, like, for example, like I oriented a guy where it's like for harm reduction, he ended up, we felt he wasn't a good fit for group, but I'm not sure if I made the right call that like someone who he was really dissatisfied with his life around the use, not yet dissatisfied with his use.
Yeah.
Like, do you think that someone, this might be a picayune question, but for me, it's something that, like, I wonder if I made the right call. Like, do you ever thought about that, about pre-contemplators?
Just time check. We have 7 minutes, so let's try to be concise so we can get a feel. That's okay.
Yeah,
Good.
no, Jocelyn, it's a great question. Yeah, it's a great
Yeah.
question. Jocelyn, just for the audience who may not know, can you define, what do you mean pre-contemplation and contemplation?
Yeah, I think I'm thinking of someone who's in contemplation is dissatisfied with their use. Someone who wants to make a change about their use but doesn't necessarily know how, or they're starting to think they're starting to see their use as a problem. Whereas someone who's in pre-contemplation is not yet seeing their use as a problem to them.
Right. Yeah. So I think, so Jocelyn, so in your question, the heart of your question, I'm sorry, say that again.
Is a pre-contemplator a good fit for a harm reduction group?
I think a pre-contemplator can be a great fit for a harm reduction group. And if everyone in the group is at a stage of contemplation or action orientation, it can be a challenge often to feel like they have enough support to be where they are. Meaning there's often, there can be a sense of like, oh, I should be doing something, which can level a sense of self-attack. Like, so meaning I would just say this, Jocelyn, my proposal is that I think they absolutely can be a good fit for group. You would want them to have at least someone else potentially as a subgroup to be able to kind of be in that space together. Or as Freedom does, I know in other places, potentially having specific groups for them. You know, I think like I said, has mixed goal groups, but also other groups that are focused on that. Yeah.
Thank you.
Can I make a very quick comment about that? Because I think the group out there who may be unfamiliar with this might be thinking, well, we're just throwing everybody in the same group together. But I think what we all probably agree on is that the more kinds of groups or configurations of groups we have, the more likely we can actually fit members in with groups and help prepare them for a group that they're open to. So we at Freedom and in many other harm reduction settings, there are abstinence-focused groups for people that want to be in a homogeneous abstinence group. We're not going to mix folks who are actively using into that group. It's just kind of a group agreement. But then there are, as Izetta was saying, mixed goals groups, which are really for people who may be pursuing abstinence and moderation and want to be in a diverse group because it's more like the real world. And I think that what you're speaking to is the importance of being very careful about preparing people for a particular group, both in terms of what is the group able to accommodate and what is the individual going to feel and experience about, joining a particular group.
Absolutely.
Just a comment. Now, Kevin Braga, who I have to give a shout out to, he's a wonderful harm reduction therapist, social worker. He was at the Center for Optimal Living also for 8 or 10 years. Amazing, both individual and group therapist. And thank you for joining us. I wish we could also have you join the team here. So more of a comment than a question. Sean, he's had a lot of clients like Sean. And he seemed to be able to openly question the group exercise while other members were accepting his ongoing ambivalence. He's seen a few Seans in his group who have a lot of shame. This was a great example about how to decrease shame. Wonderful comment. Thank you.
Thanks, Kevin. It's always.
That's great. And we have Pedro, who's beaming in from Lisbon. He says, "Muito obrigado." Thank you for joining us, Pedro. Yamil, hello, I'm interested in group work and more training. However, I cannot attend anything on Friday, Saturday, or Sunday. I would also be interested in volunteering for the group harm reduction trainings and the actual group therapy, any that you initiate. We'll take your email address and keep you apprised of our activities. Any final questions or comments from the group out there or the small group in these little boxes. I have a comment, a question actually, that I think many people who are new to harm reduction groups feel concerned about. When you mix people with different goals, aren't the people that are not abstinent or committed to abstinence potentially going to trigger the people that are pursuing abstinence? And is that kind of a problem that we should sort of protect people from by keeping those folks separate? So how do you manage that in a mixed goals group?
Yeah, it's a great question. I think that would be a wonderful kind of next dialogue we could all have around that. I think my high level response to that would be, my experience is that those who are committed to abstinence can at times be activated by people who engage in use processes. That being said, I think as long as there's open dialogue around both sides, to really give spaciousness for both sides, what I actually think it can do in actually, instead of leading to more use, it actually can beautifully help the person train with urges, desires, or differences, and actually how to bridge when someone has a different goal than they do. Just because in the world, there's many people who are going to be drinking while they're not drinking, or engaging while they're not engaging. It can be a great training ground, I think, to do that. As long as we're able to really facilitate a willingness to kind of dialogue what it's like for the individual or the group members to be in a group and have experiences with people who are engaged in abstinence. And I think, just to underline something Andrew said, because I think this is a big piece. Oh, Andrew might be frozen, which is this. And, Andrew was so helpful in my learning over the years with this, which is, in the way they think about harm reduction groups, we want to allow people to feel empowered, that they can negotiate sensations and thoughts and feelings in new ways, such that avoidance doesn't have to be done all the time. Like, we don't always need to move away from people, places, and things to actually empower change processes. So that is to say that actually we can face these things exposure-wise, real time, and also moving into a sense of choice-making empowerment, which I think mixed goals groups can do that. I think, Andrew, it can be sticky, but a real opportunity when done thoughtfully. In a bookmark thing, though. I know I'm just speaking a bit to it. Yeah.
Thank you. So we have about a minute left. Adam, is there any final comment or thoughts that you'd like to share with us?
Yeah, Andrew, I want to thank you so much. Jocelyn, thank you. And Izetta, thank you. And Shanta, thank you. And really I so thank everyone, Wendy and Kevin. I can't see you, but thanking you for being here. I think the biggest thing I just want to say is, we live often right now at a societal level in such a polarized, dynamic world. I really, really in my heart believe groups are a modality of healing and of treatment. And for anyone who has an interest in groups or running a group or engaging it, I really think there's just deep value in it. It's changed my life in the idea of being able to hold difference and integrate difference, as opposed to split difference and move it away. And I just think the more we can work in that, using these principles that Andrew and others have developed, I think the better, in both at a small level and a larger level, stepping into, ideally more compassionate, more present, more connected world. So that's what I'd like to say. And guys, just thank you so much for listening.
Such a wonderful note to end on, Adam.
Thank you.
You just gave us such a beautiful, moving presentation. And thank you for all of the participants in our little group here. It really felt very loving and supportive. And thank you to all of the folks out there who are, have joined us live, and those of you that will be seeing this recording. And please stay tuned for further meet and learn events that are really designed to create community and kind of consider contemplation together of the important issues that we all, are concerned about in our work. So thank you. I feel much gratitude to all.
Thanks, guys. Thank you so much. Thanks.